Thank you. I too, in the hours we've been here in the chamber, been listening to this debate very intently, because I know a lot is at stake here. State employees are our neighbors, they're our friends, they are family for us. And in my case, a good number of them happen to be my patients as well. So we are talking about people who are the bread and butter of our state, hardworking citizens in our state. So this debate, this discussion, when we talk about the contracts, on whom it impacts, obviously the state employees, the concern we have is whom are we impacting? And we are impacting the very people that are our friends, our neighbors. But when I look at what is a compensation for somebody who is in a private sector and somebody who is in a public sector doing similar jobs, we have seen report after report that tells us that the pay scales are very equitable, but it's the benefits, the healthcare benefits and the pension benefits that stack up and make the staggering difference, where I'm told could be about 25 to 45% higher than what one gets in the private sector. So those are the concerns. To be equitable is what we need to do, given, as we've heard, and we know the crisis, the financial crisis that our state is in. The good chairman did say in his opening remarks, or maybe in some part of the conversation, that he was not at the negotiating table when these were discussed. And obviously, there are things that he's aware of, but not there at the table at that particular time. But through you, Mr. Speaker, what was the rationale that we are holding the next legislatures and the future governors of our state for the next 5 years by extending this contract? So how did we arrive that we were going to go for a 5-year extension? I'm not sure if it's a fair question to the chair because he may have not been at the table, but I'm hoping that he would have some insight on how we arrived at extending, because what we cannot afford to do is repeat the mistakes of the past. And I know it has been done, the mistakes have been done by Republicans in the past, by Democrats in the past, so I'm well aware of that, but our job is not to repeat those mistakes. So through you, Mr. Speaker, the basis of the 5-year extension. Through you, Mr. Speaker.
Representative D'Agostino, do you care to respond?
Yes, Mr. Speaker, thank you. So, again, I'm not going to put myself in the mind of the negotiators precisely, but I think you can look at the overall deal and make some logical conclusions. You're getting that massive impact of the wage freeze, not only in the immediate years, but the long term. And then we talked about, for example, the new employees. No security, job security protection. And think about this, what we talked about before. We haven't talked about it much in depth yet, but that new plan that they're in, this new Tier 4 that we're creating, right? That's a new part of the pension plan the new employees go into that has a defined contribution element, something I know a number of members in your caucus and even members of my caucus have been calling for. That's a significant structural, unique change that you wouldn't be able to get until, if you just waited for SEBAC, if you waited for SEBAC to expire, you wouldn't be able to get that till 2022. So they've agreed to accelerate that change to this year. New employee tier this year. No job security for that tier this year. Wage freezes this year. Last year, the following year. All those structural changes. As I mentioned in my opening, that's massive. Those are gifts. And so what do we give to get that? The two main components, the job security for the existing employees for 4 years, and that's where the extension of SEBAC for that 5. But in that extension of SEBAC for the additional 5 is that new tier. are the new structural changes, the Medicare Advantage, all these other pieces. So to me, when you talk about it and looking at it holistically, you're embedding all those changes into an extended deal. And again, I go back to what I said before, because again, there's this sort of been this not confusion on this point, but maybe a little bit of deliberate obfuscation, that we've locked our hands for 10 years. Yes, on SEBAC, where the most important structural changes are embedded. But that wage and hour and conditions, those expire in 2021.
Representative Srinivasan.
Through you, Mr. Speaker, we've heard about no layoffs. I mean, that's one of the requirements for this agreement to move forward. And in these no layoffs, I also heard the good chair talk about that when we reorganize and restructure, so that can be done. And in this process of restructuring an organization, a department, if those jobs do not exist anymore, what would be our liability? What would be our responsibility to those employees? Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker. So I outlined this previously. We could spend all night talking about this particular process, but since 1993, there's been something in place called a Placement and Training Program Agreement. Right. And that typically applies for laid-off employees. So basically what we're doing is taking that structure and we're using it for restructured or reorganized employees. It says before they're restructured out of existence, they are given an opportunity to go through this process, placement and training program, just like a laid-off worker would be. Are they qualified for an opening somewhere else? If they are and they meet the various requirements of that program, they are entitled to that job. And so they can't just be restructured out of existence overnight. They've got to have, they are given the opportunity to go through that process. Again, a process that has worked well, that's been in place since 1993 for laid-off employees, that I think everybody really would concede leads to a more efficient workforce, because you're getting people in positions where they're needed and they're qualified for them. All right? And again, if they don't take that reassignment, then they're out of a job.
Representative Srinivasan.
Through you, Mr. Speaker, I get that. So when a reorganization happens and these employees now have to be moved because they no longer need to be in that department, and they can be trained and go into some other place. But at the same time, when we have a hiring freeze and those opportunities don't exist for them to go to some other department within the state, what then happens to these organizations which we do need to reorganize to be efficient, and they don't have any opportunity to go to? Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker, again, so we've got here a history. We've got more than 20 years of this process working with, we've had job security guarantees before, we've had hiring freezes before, and the counterbalance to all that is normal attrition. Literally thousands of employees over the years. That's how we've actually managed to shrink the state workforce in the unionized state workforce in the last 10 years by 15%. So I'm confident, based on past experience, that scenario you're painting can easily be avoided, because given understaffing, given attrition, given retirements, you're always going to have that flow and be able to move people in somewhere. Now, if you don't, if that scenario occurs, that obviously has to be factored into whatever department's considering that, OPM. They're going to look at that before they make a decision. But again, given the short staffing we have in a number of departments, and keep in mind, for example, we're under a federal mandate with DCF, right, places like that, given attrition, given all those factors and that how this has worked well in these exact same scenarios for the past, well, since at least 1993, I'm confident it'll work here. That's why they adopted this. That's why they carried it forward. Again, these really are not new concepts. They're just being applied to the reorganizational scenario.
Representative Srinivasan.
Through you, Mr. Speaker, you have talked about the Medicaid, the Medicare plan, and my question is, when we switch over to the Medicare Advantage plan, it is my understanding from what I've heard from you that we would be having significant savings. But also we've seen reports, Mr. Speaker, where those savings do not happen at all. And so my concern or my question through you, Mr. Speaker, is what is the basis by which you feel confident that when these people are switched over to the Medicare Advantage program, we will see the cost savings? Through you, Mr. Speaker.
Representative D'Agostino.
I would only note this is something that I know the comptroller's been talking about for years that he's wanted to do based on the folks in his department. Siegel Consulting, the group that we used, again, that actuarial reports that have been available since June 6th, they booked it as well. And if I'm remembering this correctly, to be fair, the House Republican budget includes a shift to Medicare Advantage with savings attributed to it. So I think we all agree that those savings occur with a switch to Medicare Advantage. We can quibble about, again, as I mentioned earlier, whether you can do it unilaterally or not. That's a separate legal question. But based on all the actuarial reports I've seen, the comptroller's reports, our budget analysis, your budget analysis, Medicare Advantage leads to $200 million in savings in the biennium, and those savings increase over time after that. Long-term structural change.
Representative Srinivasan.
And through you, Mr. Speaker, I just want to touch upon the pension plans. So as I understand the present proposal, the employees on Tier 1 and Tier 2, there would be no changes moving forward till this contract is over. And what we will see, the changes in the pension plan, will be in our new employees starting as early as next month. Through you, Mr. Speaker.
Representative D'Agostino.
Through you, Mr. Speaker. Actually, no. There are changes to Tier 1, Tier 2, and Tier 3. Let me just summarize you, and I thank you for the question because this is an important point. It is not just, probably the most dramatic change is this new Tier 4 with a DC plan. But Tier 1 and Tier 2, they start immediately paying more based on when they retire for their premium share. That goes up in some cases. I appreciate that some of them were at 0, so some move, if they've got a POE plan, they go from 0 to 1.5, or a point of service plan, 1.5 to 3. So that's an increase in the share for Tier 1, Tier 2. That's all Sears levels, all state employee retirement system levels. And pension contributions. So for the few Tier 1 employees that we still have, and I think there might be 40 or so, but more importantly for Tier 2, where there's more significant number, and again, I mentioned this before, I don't think people are really aware of it. Tier 2's at 0 for their pension contribution. That's a relic of something that happened, I think, 40 years ago. They move up, again, this is all effective 7/1/17. They move up over the next 2 years by 2%. So we go from, for example, depending on what tier you're on, 2% to 4% or 0 to 2. That's from 17 to 19. I know that the percentages sound small, but when you do that cumulatively, it has a big impact. That's part of these overall pension savings. So there's structural change, not just for new employees, but Tier 1s, 2 and 3, and 2A as well.
Representative Srinivasan.
And through you, Mr. Speaker, in the calculation of these pension plans, was there any structural change? It is my understanding it is the salary, it's the overtime, it is the COLA, the built-in kind of, the return rate, fixed rate of return, and also mileage. All of those components go into the pension in a defining as far as the pension is concerned. So through you, Mr. Speaker, whether it's Tier 1, 2, 3, or 4, are there any structural changes in what goes into the pension calculations? Through you, Mr. Speaker.
Representative D'Agostino.
So, first of all, there's no mileage in pension, but let me address that, I guess, in a couple of different parts. When we talk about structural, we've already talked about some of the structural changes in terms of increased contributions. I consider that structural. The COLA change, effective, I believe it's 7/1/22, is significant as well. So no longer are you guaranteed a 3% cost of living adjustment if the CPIW is at 1.5, or it's been languishing for years and probably will for the foreseeable future. So you no longer get that automatic 3%. If it's below that, you get below that, and then there's a tiered structure with respect to 60% over, I think it's 2 or 3 to 6, and then 75% over that. I'll get you the exact numbers, but it's in the SEBAC agreement. So that's structural change that's embedded in this agreement. With respect to a pension itself, let's see if I remember this correctly, there's basically 3 different components to the pension, right? How long your years of service, and your multiplier, and I'm forgetting the third, but I'll get that for you. But the multiplier is a significant piece of the pension calculation. That comes down for the new Tier 4s. That multiplier, where it might be 1.5 for Tier 5, is now 1.3. Again, that is deep structural change that really impacts the cost of these pensions going forward. And that's why you see numbers like 300 million, 400 million, 500 million. The actuary takes all that structural change into account, and that's what impacts the actuarial required contribution and reduces it significantly. That's deep structural change on various levels.
Representative Srinivasan.
Through you, Mr. Speaker, are these structural changes that you just referred to, do they apply only to Tier 4, or would they be going all the way back to Tier 1 as well? Through you, Mr. Speaker.
Representative D'Agostino.
So it depends on which ones we're talking about. For the example, the multiplier example I gave is just Tier 4, but the COLA change, that's everybody. That increase of 2% in pension contributions, that's everybody. They kick in at various times, but most of those changes span the gambit of Tier 1s through 4, and then you've got some additional deep structural change in this new Tier 4 because it is created out of whole cloth, so we're able to do some more things with that.
Representative Srinivasan.
Thank you, Mr. Speaker. I want to thank the good chairman for his answers. And my concern still is, yes, he used a very appropriate choice of words, that we are not handcuffing for the next 5 years beyond when we extend this. But that's my concern, that yes, we have made changes, we have made structural changes, no question about that at all. There are definitely parts of this agreement, of the SEBAC agreement, that I could live with. But when I look at it in its totality, I'm not able to vote on parts of it, but have to vote for the whole bill. As a total, I find that it has gone far, but not gone far enough. Thank you, Mr. Speaker.